I'm Dr. David Weiss. Today I'm going to talk about two types of fractures that we see. One is called a non-union fracture and the other is called a malunion fracture. What that means is when you break a bone, and in my world usually it's the foot bone, and so one of these metatarsal bones are commonly broken. Sometimes a toe bone is broken. Sometimes the ankle bone breaks if you twist your ankle, and of course any of these other 27 bones can be fractured. When you break a bone, there's a phase of healing that has to take place, and usually these phases of healing take about 6 weeks in order for your bone to go back to normal. If any of these phases get interrupted, then we have trouble with the final result, which is a healed bone. When a bone heals crooked or it heals in a bad position, that's called a malunion. When a bone doesn't heal at all, and on x-ray we see a gap between the bone, that's called a non-union. And these oftentimes need to be treated with surgery, where we remove the area that hasn't healed, put in a bone graft, and then put usually something across there to stabilize it, like a plate or a screw. We can also put stem cells into the area of the fractures that have been shown to heal these wounds. I've had several patients go through this successfully without surgery. However, it's rare for people to get non-unions and malunions. Reasons why these things happen are several-fold. The most common reason, believe it or not, is non-compliance, which means when the doctor says stay in the boot or stay in a cast, stay off your foot, people think, well, it's not going to be that bad if I just walk over there. Well, what happens is the bone healing gets disrupted, and therefore we have delayed healing. That happens a lot. The second reason, smoking. Smoking affects the healing of the bones due to the impaired circulation within the bone. Another reason would be autoimmune diseases such as rheumatoid arthritis and lupus, etc. These folks are typically on medications that prevent healing, like prednisone, methotrexate, Plaquenil, etc. Another common reason why these things happen is waiting too long to see your doctor after you injured yourself. I just had a patient on a previous video that had tripped in a ditch, a small ditch. She ignored some of the pain and swelling, and when we saw her, it did show that the bone was broken and separated into a different area that had to be put back together surgically, and that, if it was left alone, would turn into a non-union. Thank you very much for listening to this. This has been Foot Fact Friday. I'm Dr. David Weiss at West End Foot and Ankle.